Can one voice make a difference?
If people aren't in good health, they're not going to be able to do anything else.
For poor people, sickness is normality, not health. And if you have upper respiratory diseases, if you have worms, if you're malnourished, if you have malaria, 2 or 3 spots on your skin will not make you run to see a doctor.
When you work in these communities, you have to think in the long term. You just don't fly in and throw a lot of money at it and leave. Right. You work person by person, individual by individual. You establish long-term relationships, and then you actually can get things done.
Health, education, transportation, economic freedom, and the list goes on and on and on.
Poverty is a system. It is not a state of affairs.
I'm Kim Clark.
And I'm Pat Werhane.
We go out into the world to look at everything.
Topics such as food deserts, wage theft, and recidivism in jails.
Access to healthcare, education, welfare, major issues we face at home and around the world today.
Come search with us for answers to these issues and more
as we discovered new answers to today's big questions.
This episode depicts a project in the Ifakara Valley of Tanzania, a project of healthcare that has been run by the Novartis Foundation for Sustainable Development for over 50 years.
In the local language, the word Ifakara translates roughly into the place that you go to die, because there are so many infectious diseases, all but one, I believe, and they can study every direct disease that they need to in this one small area.
Yes, the Novartis Foundation also partners with the Swiss Institute for Tropical Medicine, because for the obvious reasons that you've just mentioned. Right. Ifakara is also the largest has the largest infection of malaria in all of Africa.
And I think we talk about it, it's up to 2 to 3 sustainable transmittable disease bites a day.
Yes, it's just not really the best place on earth that you choose to live. Our first visit to Tanzania was to a hospital, yes, which was both exhilarating and very tragic. There was a premature baby born just before we arrived, and a lovely little baby, but unfortunately the baby died. Actually, Kim was holding the baby when the baby died after 2 hours. That was very sad. In a fancy Western hospital, the baby undoubtedly could have lived.
Yeah, it would have survived here, but was not going to survive there. And it set the stage to teach us the lessons that we needed to learn to survive in this environment.
And how lucky we are.
Oh, remarkably.
And then a grandmother brought in her boy who had a broken leg.
The grandmother was there because the mother had passed away from AIDS.
Kavunjika mtoto mguu. Alivunjika na nini? Alikuwa na vijana wenzake. Sasa kaja yule kijana mwenzake mwingine alikuwa huyu. Akawa anafanya hivyo. Sasa yule mwingine kaja kwa nguvu, kampiga ngwala tap, kaanguka chini hapo mkali hapo. Safi. Unakuja lini? Na mume. Nina mume. Nilikuwa. Niko nyumbani. Mbona hajaja? Yani mimi bidi kule nyumbani kuna fani. Sasa huyu mtoto nilikuwa natoka kwenye msiba wa mama. Msiba wa mama. Alibaya.
So one is, of course, this is why we work on quality of care, so that they see there's a value in these health services. But the other thing is that you improve the benefit package. And it's what we call Community Health Fund. It's a sort of prepayment scheme whereby people, a household, basically a couple and up to 4 children, pay a premium of 5,000 up to 10,000 Tanzanian shillings. So that would be about, I suppose, between 3 and 7, 8 US dollars. And then they're covered for 1 year and can use the health services of the nearest health facility for free. What we saw and what you see a lot in Tanzania is that these community health funds do not work properly. To increase attractiveness of the scheme for people, because it's voluntary, like so far in the US understood, you are not obliged to have insurance coverage, so you must make it attractive for people.
It's not the fancy New York hospital here. We're talking about a very local, you would say primitive clinic, but they do a great deal within that confines of what they have to work
They
with.
really do a lot with what the limits of what they have.
The other thing we found out just walking around, we saw a lot of people walking.
Yes.
And they were walking to the clinic, and some people would have to walk 3 to 5 kilometers to the clinic.
Well, can we say this? Some pregnant women would walk 3 to 5 kilometers, ready to deliver, and they would sit in line and deliver the baby that day, and then
go
walk
back,
home.
and then walk home with the baby.
Which I think you were as astounded as I was, weren't you?
That was amazing. That whole project, the whole health project that they were working on.
And it was the expectation of what they were limited and supposed to do.
We also visited a clinic where people stood in line for hours and hours to get really a very basic kinds of care.
It's true.
So far, people can only go, as I said before, to the nearest health facility, while people are very mobile. At least they want to go district-wide to any health facility they want to pick, and there are, of course, quality differences, so you pick the one you think is best for you. So this is certainly something we should achieve in the nearer future, to give them that choice, and probably secondly include other health services than just primary healthcare services in the package. So far, hospital services, secondary care is not included. Most important thing is that people feel heard, that they can express their opinion, their priorities. For district health authorities, it's very important to know what we do is in line with government policy in health, is in line with what they plan usually in the district, that you inform yourself before you design your project.
The Novartis Foundation is part of the Novartis company, which is the 3rd largest pharmaceutical in the world. And they've set up this foundation to focus on particular healthcare projects that they actually know something about. Now what's interesting is the foundation has no endowment. So every year the CEO of the foundation, Klaus Leisinger, has to go to the board and say, these are my projects, these projects are going to be successful, these projects are going to be successful if I just have a few more years. And so every year they decide which projects to fund and which not. But the aim is to fund only projects which will be self-sustaining within about 5 to 10 years.
Right, so it's a 5 to 10 year cycle.
Now the Ifakara region is older because it's 50 years there because of the tropical medicine studies, and because every time they finish a project there, then they think, oh guys, there's something else they can do.
And they've really learned that poverty is a system.
Yes.
It's a system that relies on many elements: health, cash, education, sanitation, transportation, economic freedom, and the list goes on and on and on. But they were the ones to put together this idea that it's a complex system, not just one axis on its own.
And their theory is that if people aren't in good health, they're not going to be able to do anything else.
No, not a
So
bit.
the idea is to try to improve the health of this region substantially, and they actually have done it.
Poverty is a system. It is not a state of affairs. There are a lot of factors that have a circular interdependence, and if you approach a problem from one side, you still have about 35 other issues that you cannot approach. So, as we never want to put up a parallel structure in a country, but always try to work as close as possible with the government so that we become part of their endeavors, that we kind of facilitate things that they wouldn't be able to do or accelerate things. We look good because we work with people who do good work. You could never fly in from Switzerland and do something and after a week or two go back and then come back in 3 to 4 months. You have to have a stable infrastructure with people whom you can rely on, whom you can trust, and they must kind of share your passion. Oh, jetzt hat Angst, huh? Ja, Musungu, huh? He doesn't like Musungus, he wants to go down.
What we learn from Klaus is that when you work in these communities, you have to think in the long term. You just don't fly in and throw a lot of money at it and leave. You work person by person, individual by individual. You establish long-term relationships, and then you actually can get things done.
And what was really impressive was that he knows these people by name, and he knows the families, and he knows these people for a very long time.
So it was a great example of what one can do, one person can do.
I think we see progress, but yet a lot is still to be done. First of all, because a lot of the human resources are not qualified. They're sometimes only medical attendants, so they don't have the basic knowledge. So that's a problem, especially when it comes to appropriate treatment, like correct dosage, correct medicine. That's still a problem. We support the training, a health training center. And here there are different cadres really trained on a regular basis. There are nurses, assistant medical officers, but also clinical officers. That's a cadre between a nurse and an assistant medical officer. So various programs and various levels of healthcare personnel who are trained.
Another issue complicating proper healthcare in Tanzania is the infiltration of fake medication. Klaus showed us how easy it is to get fake malaria drugs from pharmacists and how it undermines the confidence and effectiveness in treatment.
Coartem is treating more than 98% of all malaria cases. You have to take 2 in the morning, 2 in the evening for 3 consecutive days.
Fake. Yeah. That's the thing we are talking. They had a problem over a few months ago to get the really Coartem.
That's Ajanta, that's a Belgian company, isn't it?
Yeah, it's a Belgian company.
Do you have Coartem?
Last visitor was
Yeah, somebody like it. Nazo zile Coartem kabisa, you know.
And why not?
It's the problem of getting you order, you don't get it.
But how come counterfeit product is here and Coartem is not here? My problem is not with them selling it as a generic as long as it contains the same ingredients, and I have this checked.
Yeah.
Because if it would not contain the same and if we go in the same doses, then we would have a legal case.
Exactly.
But let me be naive and say, what is the incentive that the counterfeit is here and Coartem is not here? I do think that if a company that has to earn the money that it is spending on my project, that this company deserves that we get the biggest bang out of the buck. And this is why we are applying different mechanisms. We are in all of our projects applying a performance-based funding, meaning that we discuss with our project counterparts what exactly do you think is the problem, and if we agree, the question would be what exactly do you think is the solution. And if we agree there, then we put an initial amount of money on the table, but every quarter they will have to come back and report on the targets that were achieved, on the objectives that were met. And if objectives were not met, we discuss why was that the case. I cannot understand, and I would not understand, why one should apply a different way of thinking in development work than one is applying in the private sector. The return on investment of the money spent should be as high as possible. The productivity of your work should be as high as possible, and this is what we are here to achieve.
One day while we were in Ifakara, we were invited to go to the leprosy clinic Well, I really didn't want to go. I've never been to a leprosy clinic. I have seen pictures of lepers on television, and I was just scared.
And all of us were nervous. I mean, I was nervous, I was scared. The only one that wasn't was Klaus, who is so affectionate and has such love for these people that he puts his arms around folks and really cares. Long term, he's had years with these folks. And it made me feel much less nervous and much more open to seeing the humanity of these folks. And I really considered it a privilege at the end. It was the highlight of the trip for me. I don't know about you.
And a highlight for me too. The interesting thing, I thought leprosy, it is an infectious disease,
Right.
but Novartis has a medicine that when you take the medicine, you are no longer infectious, nor does the disease progress.
Yes.
So none of these people we wouldn't have ever gotten leprosy from any of these people.
No.
And the sad part is they didn't get the drug soon enough to stop these terrible deformities.
Right. So in this case, it's irreversible, but it's one of those things where they can have a life afterwards, and they can have a happy, productive life if it's caught in time.
Yes.
And it is considered to us to be an Old Testament sort of disease, and
That's right.
and in reality, it's not. And we had a lot to learn. We consider ourselves fairly smart people, but we learned a great deal from these folks. They were wise and very, very kind to have us, really, kind to open their life up to us.
The affinity to leprosy comes from the fact that we have developed in the past, and what we are doing at the moment is facilitating access to leprosy medication, because leprosy is a stigmatized disease, and for poor people, sickness is normality, not health. And if you have upper respiratory diseases, if you have worms, if you are malnourished, if you have malaria, 2 or 3 spots on your skin will not make you run to see a doctor. If you wait longer, you run into a destruction of the nerves, hand and feet, and all the mutilations that you see, the mutilated feet and the mutilated hands, these are secondary infections of people having problems, women having no feeling in their finger, taking off a pot from the fire, burning their fingers, but not sensing it, and then, or people working barefoot, cutting their feet and do not feel it. And then, of course, we were looking for leprosy hospitals, because there you have a concentration of the patients, and there you have a concentration of the competence and of the staff. And one of the leprosy hospitals that we found was here in Ifakara. It was run by the Baltic sisters and by the Franciscans, and we kind of adopted that leprosarium. Same issue. You see, and they cannot even drink. They cannot hold a glass. They cannot hold a key, and that makes life very, very difficult for them. Here, that you can do by operation. Here, you hold it. Hold my finger. Yeah, exactly. Oh! We developed the multi-drug therapy in the 70s. We proved that this kind of combination therapy works best. We still do not have resistance until today. We have with the blisters, we have a good way of delivering the drug. And when Daniel Vasella became the president of Novartis, he asked me whether there's something he can do for us, and I said, please give us the leprosy drugs for free. And he said, yes, that's the right thing to do. And ever since, we are giving it away worldwide. So far, Novartis is happy with the fact that we are doing this work for the benefit of the poor people without any expectation of any return in a financial sense. I am so pleased to see so many faces that I have seen so often. On the other hand, it fills my heart with sadness that so many of you have to stay here instead of going home. But we also here to promise you we will do everything to make your life as full of pleasure as possible under the circumstances here in Nazareti. Thank you very much.
One of our most exciting days was visiting a village that had a malaria access project, and they worked in the schools encouraging children to be sure to use bed nets at home. And they worked very hard with the villagers and their families to reduce malaria infections, which they have done. And we were able, they had a big celebration that day. We were able to participate in the celebration, and they sang songs about malaria. They had malaria t-shirts. We got to dance. That was a little bit embarrassing. But
We've got you videotaped.
I was one of the dancers. It's not perfect.
Right, and you know, can I jump in? Because we have such high literacy rates, the songs become critical because they can sing a song about malaria and transmission rates that they couldn't get on a book.
The women's group is part of a project in trying to strengthen the resources, financial resources, so that they can access care. And we saw the entry point could be women, because from the literature we know when women are empowered, a lot of things could happen. Women, if they are empowered, they have been able to take care of their families more. If they're empowered, they have been able to even regulate their fertility and have fewer children. They have been able to participate in off-farm generating activities. So we saw them as our entry point, and we see the fruits already, because the women in our groups, we see their capital is growing over time. They're diversifying their income generating activities, but they're also abiding to the health conditions, like using bed nets, attending antenatal clinics, promoting health in their communities, but also delivering at health facilities.
They have a micro-lending project for the women. And in this village, the women were able to get enough money together to buy a tractor, and it was, you would think this was a Maserati. They were so proud of this little tiny tractor. They were wonderful, and all of these village micro-lending projects have all created huge savings. So they each have a huge savings account, which was really astonishing. And when you join a micro-lending project, you have to take out health insurance for your family.
Right.
A family of 4 pays $10 a year for health coverage. That's really an amazing kind of thing.
And joining this means that you contribute to the savings of the village, which then buys this tractor.
Unaninufaisha sana, hata namsomesha mtoto wangu nalipa $900,000 kwa mwaka shauri ya shughuli ya mgao. Mafanikio ya kikundi kama vile tumenunua pawatila ile, tumechangia, mpaka sasa hivi inatuingizia kipato chetu. Kwa kweli ni habari njema ya mafanikio na inatufurahisha sana, kwa sababu kila siku tunaingiza kipato kwenye kikundi chetu.
They're part of the Malaria Access Project. So part of the work of the micro-lending women group is, besides their little hairdressing salons and their tractors and their farming, part of it is, and their restaurants. Part of it also is to work with the schools in malaria access and malaria prevention.
Yes, and t-shirts become critical in this, because kids will do anything for a t-shirt that says prevent malaria, and the bed nets that come out along with that.
That's right.
But the children knew their story. They had cut infectious disease for malaria substantially since they had started this program.
That's right. They cut it about over half.
Yeah, over half.
That's amazing.
About 60%, I thought is what it was, and it's really remarkable, just remarkable.
What I see is really a strength of this project is that it has really brought health issues into the broader development discourse. We are not just addressing health as just a mere component of health system, but we are addressing it as a really broad development issue. If they are empowered, they can do really great. With little money is $2,000 USD, these women are really doing great.
We don't have an endowment. I get my money every year. We get about 10 million Swiss francs every year, plus all the products for leprosy, and plus products for malaria, and plus products for tuberculosis. The funding from the very beginning was that I would go once a year to the executive committee and propose a budget and explain what we have done with the funds in the past year and why would I need that kind of funds in the year to come. That is a problem and it is an opportunity. The opportunity is that you keep those people who decide upon your money, you keep them on board. You kind of give them ownership in what you do and what you achieve. I've been relatively lucky. I always had bosses to whom I would not have to explain that those who have broader shoulders should carry more. I do believe that all of us one day have to go in front of the Lord and He will ask you, what exactly did you do with the opportunities I provided you with? And I want to have some good answers.
In this episode, we've seen just one example of what a foundation could do in a small area in a country. But there are many, many more projects like this all over the world. And it's important for us to remember that people are doing good things as well as, of course, the bad things we hear every day on the front pages and on television. This is an important area to think about, and how we improve the health in developing nations is important to all of us.
And we've learned that poverty is a system, and one person can do something to change it, as well as a corporation. It's time to start thinking now, what can you do to change the system? And thinking as well as doing, here on Big Questions.